Hi, my name is Jacob Ladinsky. I'm currently a surgical and x-ray technician at a private orthopedic surgery clinic in Oviedo, Florida. The two items that I chose are the hand sanitizer bottle and a paper mask to see what public health means to me. Now, working inside of an office where we perform surgeries and I'm in contact with patients face to face, hand to hand, close proximity, the very personal closest that you can possibly get, I urge everybody to have these and wear them. I run through a bottle of hand sanitizer in a week using the smallest amount possible. And masks, I use 4 to 5 of them a day because I change them out so frequently. Anything that can limit the spread of infection is fantastic. Unfortunately, not everybody has access to these due to global shortages of supplies, even if the supplies are as simple as glycerin, water, and alcohol, and paper. That being said, you notice a huge disparity between rural and urban areas with low socioeconomic statuses and high education and high wealth areas. And you could say that in even Orlando compared Bithlo down here in the lower rural area to Winter Park in the more wealthy and upper class area. Some people don't have access to it. I live and travel to Bithlo for work quite often, and I see that some patients here don't even have working water. They just have wells in their front yard. And then you go to Winter Park and you see filtered water that costs $30 a bottle to make. That being said, what we can do to reduce disparities is make sure that everybody has access and lower cost of certain materials, such as hand sanitizer. It doesn't need to be a $5 bottle of hand sanitizer, and one person doesn't need to buy 16 bottles of this. It can be shared, it can be cleaned in spaces, and masks are so dirt cheap that they should be able to just be given at doorways to every place. UCF being a wonderful place does this. It's in every building for free. Please take as many as you need. That being said, too, how can people take care of themselves and responsibility for their own health is you should use hand sanitizer on your hands every time that you touch something. Your phones, this device right here, it is a disgusting cesspool of bacteria and microbes that nobody really even thinks about it. You use it in your bathroom, you use it in public, you set it down on tables and parks and whatnot, and then you put it back up to your face, it's all over your hands, and then you go to eat. Everybody has a cell phone nowadays. Everybody needs to be disinfecting it, especially if you're going to be using your hands to, say, shake somebody else's hand or introduce yourself or touch another public item in which somebody else is going to interact with. Hand sanitizer is going to limit the spread of those germs, and one person can mitigate thousands of transmission. For airborne bacterias and viruses, paper masks alone in public spaces. If you're by yourself walking, that's one thing. If you're out in public, it's as simple as just going ahead and putting on a paper mask to limit. If you sneeze in a mask, half of the germs are going to go ahead and be contained here. Yes, you'll be disgusting, but the person who's doing this is going to help everybody around them. And if one person does it and another person does it and another person does it, we're looking at a 100% chance of getting sick being limited down to just a measly 10%, where if one person's not wearing a mask in a group of 10 to 15 people wearing a mask, then the chances of everybody getting sick are almost none. So these are the two most important items to me in public health, and people can take advantage and take responsibility for their own health by just using these on a more common basis rather than just when they think that their hands are gross or everybody else is wearing a mask. Thank you.